Namaste. I welcome you all to the 61st session of GURUBODHA. I extend my cordial welcome to Dr. M.B. Gururaja. And I also welcome Dr. Raghuram sir to this session. And I dedicate this and all of my works at the holy feet of Dr. A. Chandrasekhar Ulupa. And this class is made exclusively available for weekly Easy Ayurveda weekly class subscribers. And coming right away into the session is that male 51-year-old healthy, no underlying issues, gets cramps on the right hand fingers sometimes, and after a few seconds cramps go away. What are the points that you would consider when such a presentation is, in which end our thought process goes?
Healthy, okay, no underlying issues, so we will be looking at those things. The patient is healthy, number one, 51 years of age, and no underlying issues is the main thing. Though there is no underlying issues in this particular condition, so I would like to suggest get the patient evaluated for different things like maybe anemia, blood picture, heart conditions, maybe blood pressure, injury or pain, so which had happened a few days or few months back elsewhere, so to that particular region, to the hand or the wrist or the shoulder or shoulder blade, so wherever injuries. And very importantly, diabetes also, get evaluated evaluate the patient for diabetes also, and see if the patient is smoking, very importantly. So smoking should be given away. We will take this as no underlying issues itself. If no underlying issues are there, we will look at it as a common vata related symptom and also age related symptom. We also need to see if it is related to the profession of the person. So like excessive use of hand and also the vibrating tools, etc., and the keyboard along the shoulder and also the arms, forearms, fingers, everything is getting tired and fatigue and also giving cramps and also numbness. A lot of things should be seen. So seeing different conditions here, I would like to, if all conditions are ruled out as it is said, no underlying issues, go for a simple abhyanga with Vatahara Tailas or even a Taila Dara should be good enough. So that is one thing. Looking at it as a Vata related complaint, so just you can go with a simple abhyanga and try, so that will rule out the conditions. If it eases off and if the complaints are not coming often, so then it is Vata. The age is also 51 years going towards Vata itself. So Vatahara Taila Abhyanga or Dhara, number one. So next I would suggest Dashamula Kshiradhara. So that is very important intervention here. So most of the cases of these nerves and nerve related neuromuscular conditions respond to Abhyanga, followed by Dashamula Kshira, Dashamula Siddha Kshira Dhara. That can be done. And the same milk which has been processed with Dashamula shall be taken for internal consumption also. One is Abhyanga with the Taila, Taila Dhara with Vatahara Tailas, Dashamula Siddha Kshira Dhara. The same milk can also be consumed orally. It is really good in Vata and Vatrakta conditions. And the milk processed with Ashwagandha or Bala is also good. Ashwagandha Siddha Kshira or Kshira Paka or Bala Kshira Paka are also really helpful in this condition. Another thing is Prasarinyadi Kashayam can be prescribed, so that is also really effective. There is a Taila called as Maharaja Prasarini Taila. It comes like Kshirabala 101 or Dhanvantram 101 drops, Maharaja Prasarini Taila. So that can be used with milk. And next going to Nasya. Nasya is the best therapy for these conditions, Jatrudha Vikara and also the shoulder and also the finger related condition. A mild condition of Apabhavaka or Vishwachi we can consider it here. And go with Nasya with Kshirabala Taila mainly will help, and Kshirabala 101 capsules or Taila with milk, Kshirabala 101 Taila with milk also will help in this condition. So I would also look at going with Yogaraja Gugulu or Trayodashanga Gugulu in this condition. Kokilaksham Kashayam is another one I would like to add with the Prasaranyadi Kashayam. So considering a Vata-Rakta type of symptom also. Pratyaksha Datrayadi Kashayam is yet another choice for me, seeing that Pratyaksha Datrayadi Kashayam basically consists of Triphala, and that is useful for all the Jatrudha Vikaras, including the neuromuscular condition and also including the headache and some conditions of nerves, so which are affecting the muscles, especially in the upper part of the body. Pratyaksha Datrayadi has been found really effective. And last but not the least, I would go with the Kalyanaka. Brutam. So that also I have tried in these cases of arms and arms related condition. Mahamasha Tela is yet another one which can be used for Abhyanga and also for internal intake. So these things I'll be looking at while dealing with this particular condition. And some lifestyle changes, if the person is using the vibrating tools, keyboard a lot, phone a lot, and all those things, and ati vyayama. So again, so those things should be taken care of. If the person is using the hands, especially very much, so those things can be avoided. Smoking, yes, if it is there, has to be detached from the protocol. And Vatahara foods and diets, good rest, stress-free life, all these conditions. And since it is 51 years old male, some rasayana and vajikarana dravyas. Already I have mentioned ashwagandha, which acts like both. Rasayana and vajikarana also can be looked at. Shukrakshaya lakshanas and other things also need to be seen. So all these things should be taken care of. So multi-dimensional approach, find the cause, separate the cause, nidana parivarjana. If no nidanas are there, if the person is healthy and no underlying issues, basically vata related conditions, abhyanga, dhara, nasya, and the medicines are prescribed, one or the other shall be considered.
As person ages, and if he's especially prone to diabetes, or he's in pre-diabetic stage, and also, like Raghuram sir has pointed out, with smoking, etc., this vascular issues, or as in case of diabetes, the peripheral nerve damage slash peripheral vascular damage becomes quite a common thing in especially 50 plus year old patient, isn't it?
So first of all, I would like to go with this case. Very typically, when it is said 51 years male and healthy, first itself is a typically a wrong notion or a statement to make it, or an observation to call it healthy. So we can say that 51 years of male, so-called healthy. We don't know whether it's totally healthy or not, because information available with this question is very, very less regarding the history. We don't know the personal history of the patient. We don't know the other food habits or the lifestyle of the patient and other any underlying diseases. So as far as now, there is no underlying diagnosed conditions is point number one. Second thing, he gets a cramp, and that cramps in the right hand for a few moments, it will be there and goes off. So for me, this lakshana is with very alpa matra in nature. It's not a strong lakshana. So if any neurological deficit or neurological condition is there and it is persistently, it is there throughout, or maybe he is having vibrations, or maybe having a cramps, and maybe having some numbness or something like that, or any other neurological deficits, and if it is continuously it is there, then it is really of concern. So when it is a very small nature, first thing what we would like to do is take the much more history from this patient, and second thing what I would like to do is rogamado parikshetam tadanantaram aushadam. So first I need to diagnose a condition, if at all. Just like as Raghuram sir has said, any personal history, maybe using a vibrating tool, or maybe smoking involved or something like that, that needs to be taken care of, that needs to be removed. Nidana Parivajana is to be done. Then afterwards, a very simple way of approach is to do, because these cramps and even between all these things, basically pointing towards vata. We need to quench the vata and nullify the vata. For that purpose, we need to go for simple abhyanga with balataila, or something like that with kapikachu, or something like that with ashwagandha. Can be in a minimal way, we can interfere in this, and things can be observed as the first one of the line of treatment, to observe whether it is going to give any relief or not, whether it acts as a upashaya or anupashaya. So based on that, we can further add upon any rasayanas or continuous kashayas and all those things, or any procedure that can be done later. Initially, it is sufficient to give with simple abhyanga with these informations, then using a basic drugs or the primary drugs to approach in these conditions would be sufficient.
And one more thing that, adding a little bit to here. So these kinds of, especially the hands and finger issues, are quite common one in sports people, and also who drive a lot, because they're holding steering for a longer period of time, and any local injury, or any local triggering factor can also cause that. And Moving on to the next question. The question is, boy, 10-year-old, healthy, gets small white spots on the face, but goes away, but comes back on and off. What should be the line of treatment?
Definitely, once again, so I would like to go for that question is because the representation, whatever in the name of small white spots, it is not clear from the point of view of medical language. We don't know what exactly your point about white spots, but it is any white spots comes and goes up. It may be even pigmentation issue, or it may be a fungal infection, or it may be any manifestation of deficiencies. So we need to check on those points. If we could able to see the picture of that, then we can come to certain conclusions. Whether it is due to deficiency, see in the vitamin D deficiency or any thyroid issues are there, then also there may be such chances of white spots can happen on the body, and they come and they go off. So that is a usual issue really there. Then other thing is that it may be anything related with the pigmentation issues. Then also the type of things are there. So we need to check. And moreover, in a boy in 10 years, it's usually something like that related with some deficiencies or rarely fungal conditions. Very rarely in a Western, it's very typically very rare condition is that pigmentation issues. So we need to assess whether it is a pigmentation issue or a fungal issue, or it may be deficiencies. It may be vitamin D deficiency, it may be due to thyroid deficiencies or something like that. We may check it out.
I think the information given is not sufficient to come to the conclusion. Raghuram sir, your points.
Okay, in this condition, I think Gururaja sir has given certain clarity and more details, of course, is needed. But seeing the perspective, we can go with the Krimi Chikitsa also here because see the age, 10 years. So Krimi Chikitsa, especially the Vedanga formulations when given, so probably addresses the pigmentation issues in this particular condition. And also we should see the exposure to the sun and other conditions, whether there is tolerance or not. Primarily at this age when there are pigmentation issues, consider Krimi and go with the Krimi Chikitsa. And then of course there is Kushta Chikitsa, so lines of Kushta Chikitsa or Shweta Kushta Chikitsa. One more thing is we need to see if there is Udana Vayu Vikruti in this condition. So because in Udana Vayu symptoms it is said, or the normal Udana Vayu will manifest and control Vak Pravrutti, Prayatna, Urja, Bala, Varna, Smriti, Kriyaha. So Varna or the pigmentation and also the color and the reflection, everything are maintained by so many things. One is Udana Vayu and the condition of Rasa and Rakta which are circulating. And next is Brajaka Pitta and also Ranjaka Pitta. All these conditions are seeing a liver detoxification, small liver detoxification along with Krimi Chikitsa will also do. Udana Vayu Vikruti, how to check? See if there is there are associated conditions also like Vak Pravrutti, is there any disturbance in the speech or the efforts of the child in doing certain activities. This same age group children are doing activities better than this child, so look out for that also. Okay, so Urja, whether the energy is there, the glow is there. So Bala, so the strength and immunity, Smriti, memory, all this check out for this, and mainly look out for the breathing conditions also. If the oxygenation in the body is good enough, the lung condition and also the heart conditions need to be evaluated along with the liver conditions. I think these are the gross approach. And ultimately, as the final tool, we can also consider going with the Nasya. So we can also go with, since it is a pigmentation disorder and it is also coming on face, there is no harm in trying Nasya. So these are the different perspectives I would like to look at this in the case. There is no harm in starting with Krimi Chikitsa. So just check if the boy is having regular or has had previous anti-helminthic or anti-worm treatments, so like very regularly. If it is not, never. So if it is never, then definitely go, because Krimi concept in Ayurveda is totally different. It may not be the worms or the germs or which are visible. So many shapes and sizes, and even Anu and also Sukshma, these words are used with Krimi. They are not visible, so but they are circulating in the body and they are producing some pigmentation disorders at the susceptible places. You can start with Krimi Chikitsa along with looking at the nutrition and other things. Even if the Krimis are there, so invisible Krimis are there in the system also, even if the nutrition is corrected, the nutrition balance will not be there in the child, because the absorption and also assimilation problem will be there in the presence of Krimi. We need to look at that at the first instance. So we can go in a step ladder way and hope that the child recovers very quickly. If doesn't recover, or if the pigmentation problem is there very regularly, we can think about other things like Kushta Chikitsa or Nasya or Udana Vaya Chikitsa. Initially, I think better to go with exposure related things. So just check if the child is getting exposed to some things which the child is not compatible with. Next, check out through the nutrients. Next, come with the Krimi Chikitsa and start these things, and let's hope the child starts getting better.
On a related note, there is a question on that. How does using smartphones and smoking increase Vata dosha?
Activity, I would tell. So because it becomes chalaguna, so that will increase the chalaguna of Vata. So because we are using our hands very much, so like typing or we also do that. But we need to take intermittent breaks in doing that. Ati sarvatra varjayat. Doing anything in excess is not good. So excess activity is one of the trigger factors, or also the exacerbating factor for Vata disturbance. Definitely these things, activities, when they are done beyond our capacity or beyond the measured quantity or desirable quantity, definitely it will lead to aggravation of Vata.
And mentally, when someone is using smartphone, that also leads to chinta and other things. And
absolutely, that also can be considered.
And
so
also,
too much emotional attachment with the gadgets and also the screen. that can be there. Yes.
Yeah. And do you consider vascular and heart damage caused by smoking to be in line with Vatrakta, or?
Absolutely Vatrakta. So we can consider. So, and we can go ahead and combine the therapies of Vatrakta, Vata Chikitsa, Vata Vyadhi, Vata Rakta, and also the Kushta, if more skin manifestations are there post Vatrakta. So Vatrakta can be a silent disease on the backdrop of which some skin disorders can manifest which look like Kushta and need Kushta Chikitsa. That is why always there is a bridge. I follow the bridge, like Kushta Chikitsa and Vatrakta Chikitsa shall be combined. And when there are more painful conditions, Vata Vyadhi Chikitsa also need to be brought into the picture. Absolutely, Vatrakta will be the first option.
Definitely, when smoking is done, of course, smoking is always associated with the various forms of tobacco or any other things. And this tobacco is clearly a Vivai and Vikasi Gunayukta Dravya. When it is entered into the body, it clearly bypasses all the filters and channels. Thereby, it is sukshma in nature, and it causes damage to the dhatus. So when there is, you can observe those who are consuming, doing smoking continuously, or those who are boozing continuously, their dhatus will get destroyed, and once dhatu gets destroyed, automatically in them vata will be increased. So it's directly proportional, and it can be even seen through pratyaksha pramana. So it is very clearly smoking increases vata.
And even in the Dhumapana, Ati Yoga Lakshanas, there, most of them are like Vata directly. So there is a case of a female with age 24 with a history of angioplasty, complaining of pedal edema and severe left knee joint immobility and pain. Kindly share your insights into the treatment approach. Again, the diabetes and hypertension, much of the details are not available.
For time being, I think the patient has undergone angioplasty, 74 age, Vata kind of patient, pedal edema is there. We can just go with the Shota Chikitsa. So that should be a good one. And also if there is pain, some Vatahara therapies like Vatahara medicines, oral medications, and also some Abhyanga and Svedana will not harm. So, but since edema is there, so if there is fluid collection, and if it is pitting edema sort of thing, Kafaja type of Shota in a Vata patient, again we need to see the Prakriti, the build. Gururaja sir pointed out the right thing here. The photograph of the patient and the photograph of the complaint, if swelling is there, what type of swelling, the picture will give the photograph will give a very clear picture here. And since we are handling 74 years old patient, little bit of added history also will help if more details are given. So for time being, we can go with the Shotahara and Vatahara Chikitsa. That should be good enough.
Do you think Abhyanga, whole body Abhyanga, or heavily oil involved procedures
Hmm.
In an old patient with a heart complaint, will it be taxing on the body, or should we take any precautions in that?
So here it is about see pedal edema, and if we are considering pedal edema, if there is edema, so edema can be misinterpreted. So we don't know. It may be a vataja type of shota also. Seeing the age of the patient, if the patient is slim and thin, so it can be considered as vata. The edema can look like, but we need to see whether it is vataja or kafaja. So depending on that, and severe left knee joint immobility and pain. For that, I was indicating the abhyanga, not the sarvabhyanga here. Need not be. Only as a pain reliever we can give abhyanga, mild abhyanga, and also the swedana to the local area. So as long as pedal edema is there, we need to check through. Again, not very strong medicines are not recommended here because the patient has already undergone angioplasty. We need to see how long is that duration since the patient has undergone angioplasty. Is it a recent one, or has the angioplasty been done a pretty long time? Associated kidney related conditions, if there are any. So we should not be overburdening the patient with a lot of medicines, if especially the kidney damage is also there. So we need to look through a lot of things. So detailed history is needed. So here Shotahara Chikitsa, mild medications to relieve the swelling and also the edema, and Vatahara Chikitsa mainly locally for that painful knee joint. I'm just indicating the symptomatic and also the theory based approach for this particular condition, seeing 74 years and having undergone angioplasty, not to take risk, playing safe, and also advising certain things which can help in relieving the symptoms for time being. A detailed history is needed here. Not sarvabhyanga. I was not trying to look at sarvabhyanga giving a burden to the patient. Even one abhyanga within 15 days or 1 month span for age of that is 74 years old patient who has undergone angioplasty. If the angioplasty has been undergone at the age of 73 or 72, 1 year gap, abhyanga, sarvabhyanga definitely can be conducted. Swedana we need to take care of. So mrudu swedana we can give light swedana. Abhyanga is definitely it can be done, especially if the patient is thin and belongs to the vata prakriti.
I mean, I feel that this Shotahara Chikitsa, especially with something like Dashamula, in an elderly patient with pedal edema arising due to heart, cardiac conditions, slash even if kidneys are also not performing up to the mark, can be very effective, especially with herbs like Gopura, which are there in the Dashamula, and Bilva, which have Rasayana effect, and there is this Shalapani, Prushnapani, which are also frequently used in the heart. So Dashamula seems like a good strategy, sir.
Definitely, Dashamula is the good one. Along with this, we can even add Punarnava into this, and that will also going to help us because Punarnava is a Shotahara. It is also one of the, particularly where there is a pedal edema or something like that, then also we use it, and it is one of the important anti-inflammatory drug. So it also reduces the inflammation. And as very clearly pointed out by Dr. Raghuram sir, that's very clearly there is a knee joint immobility and pain. So we can go straight away go for that condition locally. We can go for Jhanubasti, and we can use Bruhat Saindhavadya Taila or something like that with the extra salt in that. So definitely it will going to reduce the knee secretions because it's a synovial fluid increase in that. That's the reason it is a OA condition. So that's why when the age is also supporting. Maybe because of that reason. So we can use definitely the Dashamula. We can use it Dashamula Churna for Koata purpose, and the hot fermentation with that can be given locally after that, particularly that Janubasti. And similarly for using extra with Pununava into that, definitely we're going to support this condition.
A 52-year-old menopausal female with history of diabetes, frozen shoulder, low appetite, hypothyroidism, constipation for which psyllium husk is taken, 3 times urination in the night, overweight, knee pain, and history of facial palsy, urinary tract infection, allergy to some allopathic medicines, prone to bruises, rashes, and itching, and currently on metformin, is antidiabetic medicine, thyroxine, which is thyroid hormone supplement, and Nutrala daily active, had terrible bleeding and suffering through 7 years of menopausal period, works on computer for 13 hours a day. I'll go first with Gururaja sir. Please, your initial thoughts on this, please.
Definitely, 52 years old female, already menopause has occurred. There will be sufficient hormonal disturbance. Along with that, she is also suffering from diabetes. And diabetes, because of the diabetes only, she has resulted in a frozen shoulder, low appetite. We need to question it and check it out. What's the reason? Hypothyroidism, definitely. So she has all endocrine involvement, pancreas, thyroid, and everything. And even she had a problem with her menstruation. So there was 7 years of heavy bleeding. So all these things very clearly indicates this multi-endocrine system is involved. And at right now, she's suffering from diabetes. Whether her blood glucose levels are under control or not, we don't know, because she's using 3 times the washroom in the night, so urination, and of course she is overweight, and because of that, there's a knee pain. Definitely, menopausal women definitely will have issues with the serum calciums and all those things. And definitely she is working on computer 30 to 40 hours a day, means no question of going out in sun. So definitely her vitamin D levels will be low. And those who are hypothyroidic patients, definitely their vitamin D is also somewhat low. So all these issues are related with certain deficiencies and lifestyle disorders and certain endocrine linked one. So we need to assess all these things, and we need to address one by one by moderating her diet pattern, her way of life, leading things, and all those things that needs to be taken care one by one. Then only we can at least give some relief. The first point would be reduction of our body weight and controlling of diabetes. These are the two important things. First we do it, then definitely other things will fall in line.
Like rightly you have said in many other previous sessions also, like body weight, if you are concentrating on that, hypothyroidism problem gets resolved to some extent, then many of the things start falling in line.
Here we can say diabetes is there, hypothyroidism, low appetite, constipation, excessive urination, overweight, everything indicating to the metabolic syndrome. So yeah, absolutely it is a metabolic syndrome here. So again, as Gururaja sir rightly pointed out, the main culprit will be the Medo Vaha Sroto Dushti here. The fat, the body fat needs to be taken care of. Workout on the weight. For me, Udvartana for time being, Abhyanga, Udvartana and Swedana, and possibly a Nitya Virechana. Seeing the bala of the patient, I think it should be good enough. Even if Virechana is not given, even a Krama Virechana can be given, like gives Snehapana, combining Gugulu Tiktaka, Gruta, and also Varnadi Gruta combination, and then come with Abhyanga, and then Udvartana. Udvartana should be brought into the picture. So I am handling these cases in this way. Abhyanga, after Abhyanga, it should be Udvartana, then followed by Swedana on the same day. Abhyanga, Swedana, anyhow we are giving. Abhyanga, Udvartana, Swedana. So that should be there. And Virechana. So Virechana should be planned seeing the bala of the patient, number one. And I think once these things are done, and regular exercise and a little customized diet is prescribed to the patient, and very importantly, the stress factor is enormously involved in this particular condition. A lot of counseling needs to be done. It looks like a Vadisankara, an amalgamation of so many symptoms. Mainly, this looks like a Kapha-Vruta condition, Kapha-Vruta Vata. Look at the constipation there. Constipation is there. 3 times urination is there. So we also have knee pain and history of facial palsy. Seeing all these things, it is Kapha-Vruta Udana and Kapha-Vruta Samana, Kapha-Vruta Apana. Everywhere the Kapha has spread. So Udvartana will be the best thing in handling these things. Meanwhile, we can go with the Prameha Chikitsa like Nishakatakadi, Chandraprabha, or some milder medications can be given, maybe with an Avaka Gugulu combination. So I think initially if Meda and Medo Vasrotas is taken care of, I think this patient will start responding in a better way.
In the post 40 age women, if they were healthy previously, not obese, and they start gaining weight, probably it's a, and if they are like workaholic, as is in this case, like working 13, 14 hours a day, probably it's a nice strategy to reduce the workload a little bit, or somehow squeeze in 1 hour of time, if possible, in the morning, so that they exercise and they take care of themselves. If that care is not taken in the 40 plus years of time, by the time they reach this 50 years, as in this case, many other things add up, and reversing the things become very.
Absolutely right, Dr. Abha. I think in the pre-menopausal and also especially when we're speaking about women, pre-menopausal condition itself, as the woman is approaching the menopause, and if we can see some metabolic changes, weight gain, borderline diabetes, borderline hypothyroidism, and all those conditions, definitely a course of Virechana here and there will help, maybe twice in a year. So including Udvartana into the treatment protocol every now and then, I think it will be a fantastic thing, at least to avoid certain things, certain symptoms creeping up by the type of menopause. I think a healthy menopause can be seen by that woman if we can take care in the premenopausal condition itself. So the menopause for many women, it is a painful condition. For many people, it is it just comes and goes away as a pattern, so they don't even have time to have a look at it. Mild symptoms are there. Some women face enormous symptoms like disturbing symptoms. So seeing that, exactly, it is also very important in the woman care that at pre-menopause, or the woman hitting towards the menopause, when the periods are taking a big gap between two periods, at that particular time, if these metabolic complaints come, so it is better to take an advice from the Ayurvedic doctor and take precautions so that they don't develop these metabolic symptoms, number one. And very importantly, when the Medas and Medhavas Rutas are affected, one big problem which comes in the woman will be the bone-related problems, bone and joint-related problems, depression, and all those things. The Medas, the fat, is the primary culprit, and it needs to be taken care of. Medas avrtamadhyatvat pushyantanyena datavaha. No other tissues will be nourished when there is excessive fat accumulation and it is blocking and clogging all the srotas in the body. So very importantly, the bone health also will get hampered in the pre-menopause and also the menopause and post-menopausal conditions that need to be seen of osteopenia, osteoporosis, and related bone-related condition. So to add weightage to that, if the woman gain weight, so even this osteopenia and osteoporosis will be very horrible to tolerate. So these things can be taken care of in the pre-menopausal. So prevention is better than cure, is the right strategy here.
And sir, what is the age limit beyond which you would not think about Virechana, especially in women?
Virechana,
top age limit for Virechana in women?
No, we can go with Virechana at any age. So seeing the bala of the patient, mainly I wouldn't be looking at the age here. So even a Triphala Churna or a Haritaki Churna in the small quantity, okay, so those things can be considered for short-term use. As I keep telling that I'm not a big fan of long-term prescriptions. A short-term use, if at all, if it is required. When speaking about Krama Virechana can be definitely given, maybe even at 60, 65 years also, Virechana can be given if the person's bala is good. Number one, the patient is obliging to go with Virechana therapy. So Ayurveda is all about experiencing the treatments, that's all. So many people have hesitancy. If the patient fits into Arha and Anarha, so there are two qualities here. So like whether the patient is fitting, we don't call them as patient, whether the woman is fitting into the category of Virechana or not. Okay, so a woman with very much cardiac conditions, heart related conditions, on and off, in such conditions, so maybe 50, 55, 60 years, having some heart conditions or a family history of heart conditions, going for a Vamana and Virechana without evaluating the heart may be really a difficult scenario for the doctor also, and also uncontrolled diabetes levels and all those things. We need to evaluate the patient. Two things need to be taken into consideration: Vyadhi Bala and also the Atura Bala. If both things are fitting into the treatment of that is the schedule of Virechana can be done even at 60, 65 years of age. So the planning is needed. The bala of the patient needs to be evaluated. The bala of the Vyadhi needs to be evaluated. The chronicity of the Vyadhi needs to be evaluated, and how much damage the problem has created in that particular person. These things need to be evaluated. After evaluation of everything, if the patient really fits in, I will definitely go with the Krama Virechana. Krama Virechana here in the sense giving Snehana, Swedana and Virechana. Or else, if a mild purgation is needed, a Sramsana or a Virechana, a mild laxative, if it is needed for small conditions like a constipation which is running for a few days and any other conditions, I will look at giving a small set of Virechana Dravyas for a small set of days, like a small short duration, without going for a long duration. Here, if we are speaking about the Krama Virechana, Yes, these things need to be evaluated.
Okay, patient 82 years old. He had a heart attack long time ago, maybe approximately 20 years ago. He's fine now, but only thing from the last 5 years, the patient weight has gone from 62 to 80, sorry, 42, possibly once a day. That's the maximum he eats. He doesn't have any good appetite in a way. Some signs of depression also. He's a lawyer. Question is how to resolve his weight loss and how to go with the line of treatment.
First of all, 82 years of age definitely falls under the category of vata domain, and definitely vata will have to show its effect. And definitely because of that, body mass will reduce. In each and every cases, usually body mass will reduce when we reach such age. Point number one. Point number two, there is a sudden loss of body weight, maybe within few years, almost he has lost 50% of his body weight or something like that. So then definitely we need to check diabetes at the first level. But healthy, no diabetes. Okay. Then second point we need to check is how much food he is consuming, how much nutrition he is taking. In that he takes only once a day. So that may be one of the supporting causative factor there. Maybe because of loss of appetite, or maybe not interested to mix with the people, or not interested to eat, or maybe is feeling that I am not enough to be, I will not be able to, or I am not interested to stay back in this world or something like that. Maybe some negative feelings that needs to be checked in once. The other thing is that there may be some hidden cancer that needs to be checked. Whether any such things are there, any tumor markers you could be able to find, that needs to be checked in. That's one part of it. Then the other one issue is neurological issues. Many times, neurological issues like Parkinsonism or some lateral sclerosis or some conditions, then also patient will not eat much, his body weight goes on reducing. Such type of any neurological deficits or neurological issues are there, that needs to be checked in. If that is not there, then his food quantum should be made to increase so that it balances. So we need to check on these points.
Yeah, so here Gururaja sir I think has covered maximum points. Main thing is evaluation. Evaluation, if there is a drastic weight loss or a weight gain, the conditions behind the screen needs to be evaluated and brought into the picture. So and at 82, we should see the patient is already 82 and belongs to the vata category, and we also need to see prakriti of the patient. If there are three different things which happens with aging. If the person is vata prakriti at birth, the weight loss will be more in comparison to the other prakritis towards the old age. If the person was pitta pradhana prakriti at birth, the weight loss will be moderate. Weight loss will be there. Definitely the tissues are degenerating towards the age, towards the vata kala, immaterial of the person being vata, pitta or kapha, whatever prakriti. But the weight loss will be drastic in vata prakriti person. It might be a quite natural phenomenon. In pitta pradhana prakriti, it may be a moderate weight loss towards the aging. And in kapha pradhana, it will be a slow weight loss. So the trick is, if the person is kapha prakriti, right from the beginning, kapha pradhana prakriti, and there is a drastic weight loss towards 70, 80 years of age, which shouldn't happen in comparison to a vata prakriti person. If that is the case, things needs to be evaluated. In each case, it is our responsibility to evaluate the condition, because here Vyadhi Pratyanika Chikitsa is very important. What is there behind? Number two, the drive of the patient, whether the person no such exercise, mostly like to stay on the bed. So this is one more complaint from the patient. The patient doesn't like to move from there. So we need to see if there are any mental inhibition. So counseling, a lot of counseling is needed. Even at 82, we can make the person feel like the person is at 75. Encouragement. So somebody be with the patient, take them to a walk. Okay, so all these things, counseling, and also any mental inhibitions or any causes are there, they need to be removed. Mobilize the patient, mobilize the person, take the person away from the home, take for a walk, take on a picnic. So here, the treatment for the manas and also the sharira. So ubhayataha, the approach should be both psychosomatic in this particular condition. If there is any emotional constipation, if the person wants to do something which he or she might not have accomplished that, there are some mental constipations. So like, I wanted to do this at this particular age and I was not able to do that. So we can even take the list of that wish list of the patient, and that you can drive the patient from there. Okay, this is your wish list, 1 to 10. So we are going to fulfill this. I am going to be with you. So that makes the person move from the bed. So that itself will be an exercise. So here, 82 age is a tricky age to manipulate these things, and very important will be the will and the personal drive of the person. Whether the person wants to come away from the bed, move out, what does the person like, and all those things, and other things. If it is really a weight related issue and the person cannot move, if there is a fear because of the weight loss, drastic weight loss, the conditions behind the weight loss needs to be evaluated and addressed, as Gururaja sir rightly said about diabetes or neurological issues or cancer, whatever it may be.
And I've seen that, especially, I think the willingness to move around and willingness to go out and at least to have a walk, or just to go to the nearby grocery store and to buy something. If that is lost, then it becomes really difficult to, because the motion is restricted and the person is immobile most of the time, and then the cardiac things start setting in, circulation is obstructed. And also, if their ability to move and ability to do minimum amount of exercise or at least some basic physical activities, and keeping the mind fresh and excited for some things, whatever their interest is, that will itself will indirectly take care of the agni, and things fall in line. And also, happy mind also tends to gain weight.
Yeah, there are two types of tendencies here. See, Vata Prakriti persons will always have a weight losing tendency. If they're left as they are, if Vata is taken care of by themselves, and if the body's Vata is taking care of itself, the person will always have a Vata. So will be thin to moderate, or will definitely have a weight losing tendency. And Kapha Prakriti people will always have a weight gaining tendency. Like the child born at birth can be a plumpy child, a fat child, and suddenly by teenage the child can lose the weight and become thin. So by just looking at the child, we cannot tell that the child is Vata Pitta or Vata Pitta Prakriti. So because due to different factors, there is thinning of the body, and later towards the later middle age and towards the old age, again there will be a tendency, the Prakriti will hit back. So the person will have the tendency to gain the weight. And in Vata Prakriti, the person will tend to, even in the middle age, if the person has become obese, and if the person follows everything which is within the bracket for a Vata Prakriti person, like activity, maybe food, maybe attitude, behavior, everything. So definitely the person will have the weight losing tendency without much efforts. And in between these two conditions come the Pitta Prakriti person. So the Pitta Prakriti, because there is Agni, there are burnout. So it can be balancing this way or that way. So, but it is more easier for the Pitta Prakriti people to balance rather than these two other versions of Vata and Kapha. Vata has, what I have seen is Vata has losing tendency, Kapha has gaining tendency. Pitta can also lose and gain, but moreover, since the Agni is more in those persons, if the Agni is maintained, everything will be maintained.
There is this question of vitamins again, and we have answered that previously. The question is that vitamin D testing and supplementation is not part of traditional Ayurveda as far as known. So what is the Ayurvedic equivalent or none required? And because many persons these days are told they are deficient in vitamin D and B12 and put on supplements even in young children. Just to summarize what has already been told, laboratory techniques are part of Ayurvedic diagnosis, at least in the current times and age, where everyone wants proof. And Ayurveda is blamed for being anecdotal and hearsay and all those things. So if it is in paper, it's easy to prove. So if there is the consensus that has been raised and arrived with all the previous sessions of GURUBODHA is that if the person undergoes a test and there is vitamin D deficiency, then some amount of Agni improving treatments are given, and then along with that, if the vitamins are supplemented either via the diet, like vitamin D, sunlight, or the foods rich on vitamin D and B12, either via that or in the form of food or activities or in the form of supplements, it's okay, even if it is not told in the Shastras, is one thing. And another thing is that if there is this, going with the complaint here, if there is vitamin D and B12 deficiency, there are many causes, especially in the young children, as told, like nutrition less diet, junk food, and there are causes such as certain medications, poor gut health, again Agni, and chronic stress, low digestive strength, low stomach acids, enzymes. So these also cause. So improvement of Agni also comes into picture here.
Of course, regarding this vitamin D and some type of vitamin B12 or something like that, which is not told in Ayurveda as a classics, we can't expect that also because it's entirely new thought. That doesn't mean that the symptoms what they are enlisted doesn't match with these things. Of course, there are certain conditions which matches with these enlisted things, but Ayurveda way of approach is something which is elaborative, and we may have to go for an abhyanga, we may have to go for a milk diet, we may go for certain herbs, and then we have to expose ourselves to sun. So many a times the people are working hard in such a way that 13 to 12 to 13 hours they are sitting in front of the computer and doing the work, and how can you expect them to go out of these things and do all these things? So better way is just to go for a supplement which is very easy and cheaper, and it is very rapidly increases these things. But I'm still worried whether that rapid increase of the vitamin D will bring down or reduce all those symptoms which was previously present in the vitamin D deficiency. I am not sure about that because I've seen many patients with vitamin D complaints, deficiency complaints, when the vitamin D is being supplemented. Then also the supplementation, after that, once again, you recheck the things, the vitamin D is in a normal range, but still some of the previous complaints will do remain in them. I don't know why, what is the reason for that? So when such conditions are there, then better is, as it is pointed out, that Agni improvement is one of the important thing. Then go for Abhyanga, then milk diet, sun exposure, and oral supplements as required. Then that will be better for that.
What therapies can be given to the teenage and young teens and young adults for anxiety and depression? There is a lot of anxiety and depression in this, especially the teenagers nowadays. A point of worry for almost every parent. They'll be home for 3 weeks, and moms can bring them to Panchakarma. Especially, may not be for the medicines discussion, because we are running out of time. Specific therapies that you can think of.
Number one, counseling. Anxiety I will see as a vata predominant disorder, and I'll go with the Dara, Abhyanga, Svedana type of therapies. Maybe a Basti in severe anxiety. Depression I would look at as a Kapha predominant condition, or a Kapha Aurta Vata or Kapha Vata condition. And in that condition, probably a Vamana followed by Virechana with the counseling and some medicines which can address that particular condition. I will have a look at it. So you're looking for a quick answer. This was my quick answer. And Dr. Habar, one more thing. For the previous question, vitamin D deficiency, I would like to add a Tikta Basti there. So enemas with Tikta Kshira, Kshira Basti, or any Tikta Basti like Gulu Tikta Kagruta or something. So as Matra Basti, I think that will be really good. When we see through the vitamin D deficiency there, obviously we are speaking about the bones, the weak bones, osteoporosis and all those things. Astikshaya obviously reflects the Vata Vruddhi. So Basti is the best treatment. Tikta Kshira Bastis and also the Tikta Guta Bastis have given fantastic results in the symptoms of vitamin D deficiency.
See you in the next session of Gurubodha. Thank you.